afternoon. My name is Val Sparks. I'm the infection preventionist, occupational health, and workers' compensation coordinator here at Midland Memorial Hospital. And I'd like to welcome you to the hospital, of course. And here's the good news. I'm the last talk of the day. Yay! So when I finish, some of us will go upstairs to occupational health, and we will complete your charts. You'll get your lab results back. Some of you need immunizations. Some of you need to be scheduled for fit testing. Okay, we'll get all that done. And then some of you will be all right to go. And then you'll clock out and go home for the day. Okay? All right. So the good news is that we don't have any papers to look at or anything. You are going to take an online course over the next week over infection control. You will see me on a PowerPoint. We will be talking to you. We've made it animated, and it's delightful to watch. I'm sure you'll remember it, okay? But in the meantime, I'm just going to do a quick PowerPoint here, just kind of hit the highlights of what you should be looking for and some key things to remember, okay? So just listen up. And if y'all have any questions, don't be afraid to ask, okay? All right. We're going to start with hand hygiene. This is the basis. All our mamas taught us how to do it. We turn on the water. We get it a nice warm temperature. Yes, we have warm water here. We wet our hands and wrists. We get 1 squirt of liquid antibacterial soap. Yes, we use antibacterial soap here because we have bad bugs here, bad bugs. All right. Then we're going to make bubbles. The palms of our hands, the backs of our hands, your wrists, in between your fingers. Maybe you need to clean underneath your fingernails. Okay, your wrists. All right, you've got the bubbles. Then you're going to wash the bubbles and the germs down the drain underneath the running water. You're going to leave the water running. You're going to grab 2 or 3 paper towels, dry your hands and wrists well. Then you're going to use the paper towels, turn the faucets off, throw the paper towels in the trash can. You're done. Okay? It's simple. You can do it all the time. Okay? Now, we also have alcohol foam. It looks like this back here on the wall, the alcohol foam dispensers. That's in around the tower. It's by every patient room, different departments, the cafeteria. You hit it once. You'll get a squirt, about a quarter-size amount of foam. It's alcohol foam, okay? You're going to rub it the same way. The palms of your hands, the backs of your hands, your wrists, in between your fingers. Rub it till it's dry. Don't blow it in the air. Don't blow on it, okay? Because all you're doing is putting germs back on your hands. So we're going to rub it till it's dry, okay? So that is also a way you can decontaminate your hands. You need to wash your hands upon entering every patient's room, before and after direct contact. When you take your gloves off, okay, you can decontaminate your hands. Those of you that are involved in direct patient care, phlebotomy, cardiopulmonary, radiology, nursing, okay, you cannot wear artificial fingernails or extenders. You cannot wear artificial fingernails or extenders if you physically care for the patient and touch them. Okay? You can wear nail polish. It needs to be fresh, not chipped or cracked. I highly recommend the shellac. It works great. Okay? It'll stay on 2 weeks. All right? Shellac on your natural nails if you've got to have nail polish. Your fingernails should not be any longer than 1/4 inch over the tops of your fingers, so you're not going to rip the gloves, you're not going to scratch the patients, etc. Okay? We do have a just culture written into our hand hygiene policy, and what that means is that you cannot be considered blameless. You cannot claim, no one told me I had to wash my hands. Oh, yes, we did. Okay? I told you here, there's a policy, you're going to get more of it on the computerized education, okay? So if we catch you out not washing your hands, okay, potentially you could be written up, and that could be one of the things that could lead eventually to termination based on human resources policies, okay? All right, just so you understand that. You could lead to corrective action, all right? Any questions on hand hygiene? Everybody can do it, right? Okay. The next one we're going to talk about is standard precautions. This came about in 1991 with the OSHA mandate. OSHA is Occupational Safety and Health Administration. You will be taking a test on the computer on this, okay? So pay attention to your computerized education. Basically what we're telling you is that you cannot tell by looking at someone what they have and do not have. They do not wheel into the emergency room with a neon sign across their forehead that says, be careful, I have AIDS today. Be careful, I have syphilis today. Okay? You have to protect yourself from everybody all the time. From the itty-bitty baby to the 99-year-old grandma, you don't know what they have. Okay? Protect yourself from everybody. Whether you go to church with them, you know them personally, you protect yourself. Okay? We provide, Midland Memorial provides the PPE. PPE is personal protective equipment. It's up to you to put it on. I am not your mother. I'm not going to run around behind 1,600 employees and say, oh, Catherine, be sure you put that on. Okay? All right, so you need to know where your gowns, your gloves, your masks, etc. are located. That's one of the things in your first week or so you should be able to locate is personal protective equipment in your department, if you need it in your department, okay? And know how to put it on. You're responsible for that, okay? Please plan ahead and be prepared. Know what, anybody work in the emergency room? Okay, then you know when you've got a trauma coming in, you know what to expect. So get your PPE on and be prepared when they hit the ER, okay? Also, part of standard precautions is the hepatitis B vaccination. It is free. That's a 4-letter word. It's also another 4-letter word, a shot. S-H-O-T, okay? It's a shot in the arm. It's a series of 3 shots. You take one today, you take one 30 days from today, you take one 6 months from today, okay? It's a series of 3 shots. Everyone in this room, it is made available to free, no matter what your job description is. You don't have to have direct patient contact, okay? So please take it. Now you can sign a declination statement that yes, we offered it to you, but you don't want it, okay? But if tomorrow you go home and you talk to your significant other and they tell you, well, that was dumb, it was free, okay, you can always come back and start the vaccination. But today, I have to have something in your employee health chart that says, 1, you already have antibody titers, because we saw that in the blood you drew, okay, or you're going to start it, or you're going to sign a declination today that I don't want it, okay? All right. I need to tell you that standard precautions applies to all blood, all body fluids, secretions and excretions, except sweat. They can sweat on you, okay, and you won't be exposed to anything. Regardless of whether it contains visible blood or not, it applies to all non-intact skin and your mucous membranes. Now, your mucous membranes are your eyes, nose, and mouth. We have a mucous membrane below our waist, but we keep it covered while we're at work. Don't ever uncover that mucous membrane, okay? It is the policy of this hospital that all body substances from any individual will be considered infectious, and all healthcare workers, that's all of you, must routinely use the appropriate PPEs to prevent skin and mucous membrane exposure when contact with any body fluids from any patient is anticipated, okay? We've already talked about hand hygiene. Gloves are available for you in every patient room. Needles and sharps are to be handled with extreme care and minimal manipulation. You do not recap, bend, break, or remove needles from syringes. You place the whole thing directly into the sharps container, which is located as close as possible to the area of use. That's in the patient's room, that's on the crash cart, that's on your phlebotomy cart, that's in your radiology exam room, okay? You need to know where the closest sharps container is and use it. Don't ever leave it on a dietary tray, throw it in the trash, leave it in the bed, carry it in your pocket, okay? Not good, not good, okay? Gowns and aprons, of course, are available to protect your clothing, your uniform. Please use those. Resuscitation equipment, all of you will have heart saver or basic life support. You will all know how to do CPR. Okay, that's a rule here in this hospital. Everybody, no matter what your job description is, I think they've told you that already. Okay, hopefully you would never have to do mouth-to-mouth resuscitation in this facility. Okay, we use the ambu bags, we use the mask, etc. Okay, now obviously out in the parking lot, I can't guarantee you wouldn't have to do mouth-to-mouth resuscitation. Okay, or at the soccer fields or something like that. Okay, all right. Soiled linen should be handled as little as possible and with minimal manipulation. You need to roll it all up and stick it in a plastic bag, okay? Don't ever carry linen up here next to your uniform. I have children and they have stinky socks and yick, and we don't even do that at home, okay? It all goes in a laundry basket. Here, we don't have laundry baskets, we have clear plastic bags. Everything goes in there. Don't fill it so full that it's too heavy to you strain your back, okay? In your dirty utility rooms, there are certain hampers. You walk in a dirty utility room, you have a trash bin, you have a linen bin, you have a red biohazard tub, you have a reprocessing bin, okay? And we reprocess certain things, SCD sleeves, heating pads, etc., okay? Things that are non-invasive, we do reprocess those. A company reprocesses those. But be sure you get the linen in the linen hamper, not in the trash hamper. Okay? You got to sort at the site, and that's in your dirty utility room. Okay? Do y'all have any questions about standard precautions? Okay. The next one we're going to talk about is isolation precautions. These are all in addition to standard precautions. We use standard precautions on everybody, but from time to time we have to do different types of isolations on patients because of identified infections, okay? The one we use most often is contact. There are these signs that are around the hospital for quick reference for you, okay? The one we use most often is green. It's contact precautions. And this is for methicillin-resistant Staph aureus, MRSA, Mr. SA, Mrs. A, however you care to remember that acronym, okay? That's the one we see most often. I ask that you always wear gloves when you enter the room and contact the patient. You might need a gown, and the gowns are available. We have isolation caddies hanging on the patient's room, okay? And all your PPEs are available there to enter the patient's room. Use them, okay? You must wear gloves. You might need a gown if you're getting the patient up to the bathroom, to transfer the patient, to take them down the hall, to go to radiology, whatever, okay? But most of the time, we just need gloves and hand hygiene, okay? The next one we use is blue, and it's called enhanced precautions. It's enhanced because you always wear gowns and gloves to enter the room. If you cross the threshold into the room, you should be wearing gowns and gloves. These are our poop bugs. This is the vancomycin-resistant enterococcus, VRE, and Clostridium difficile, C. difficile. These patients have diarrhea, okay? And it's kind of like a fecal veneer all over the room. Housekeeping, how many housekeepers do I have? Okay? You will, when you see the blue sign, you are trained to use bleach. You will clean that room with bleach. Everybody else, when you have a blue sign, you must always use soap and water. You cannot use alcohol foam to clean your hands. Alcohol foam does not kill Clostridium difficile. Okay? You must wash your hands when you come out of the room. Going in the room, you can hit the alcohol, clean your hands, put your gloves and gown on, okay, and go into the room. But when you come out, you have got to take your gowns and gloves off and wash with soap and water. Okay? The next one is droplet precautions. This is the orange one. This is the one where we wear a yellow isolation mask that covers our nose and mouth and it hooks on our ears. It's a little thin yellow isolation mask. We use this for influenza, flu season, which is just now finishing up, meningitis, possible meningitis, or pertussis, which is whooping cough, okay? And we've had all three of these this season, all right? But you must wear a mask. Now this mask, you must wear it if you are in close contact. I say arm's length, okay? Where her and I could exchange oral and nasal secretions, okay? If she coughs, it's going to get in my face and vice versa, all right? If all I do is open the door and say, Catherine, have you ordered your lunch yet? I don't need a mask to open the door and speak with her. And the door does not need to remain closed on the floor, okay? But if I'm getting in her personal space where we can share oral and nasal secretions, then we must wear a mask, okay? Not a special mask, a surgical mask, isolation mask. They're yellow, okay? The next one we use is hot pink, is airborne or TB. AFB is acid-fast bacilli. This is if we think or we know they have tuberculosis. We're doing a rule-out TB, all right? They also call it respiratory or TB precautions. Just so you know, doctors can order them differently, all right? You must wear an N95 Decimus respirator. It is a special high filtration mask. It will fit tight to your face, and you will be fit tested for this in occupational health. That's why we need to have, you need to know what size and kind of mask you wear. It all depends on your bone structure, your nose structure. Gentlemen, if you are entering those rooms and you have a beard, okay, you may need to shave. You need to be clean shaven. It needs to get a tight fit right here. Usually the mustache and the goatee is all right if it clears under here, all right? But you have to have a tight seal. I don't know if you've ever used like a styrofoam cup and you put it on your face and you suck in and you can hold it with no hands. It has to fit tight. That's the fit check test. And you have to be able to suck it in and hold that mask in, okay? And you can't do that if you have facial hair growth and you can't get a tight seal. Possibly. Where do you work?
Okay, first.
No. Where are you going to work? Here. No, you'll be fine. You won't be going into patient's room. You will not be fit tested, sir. Okay? So you're lucky. You don't have to shave today. All right. Okay. Those are the different types of precautions, and these are always used in addition to standard precautions. Okay? Now we need to talk about cleaning. Cleaning by non-critical equipment by all personnel. We have wipes around. They're like in a baby tub with a green lid. They are hydrogen peroxide wipes. Okay? You can use them to clean computer keyboards, your Cisco phones, your stethoscopes, any piece of equipment that comes out of a room, you can wipe them off with these hydrogen peroxide wipes. The other good thing is that you do not need gloves necessarily, okay? It won't hurt your fingers. It's hydrogen peroxide, okay? They're not a baby wipe. You don't use them on a baby's bottom. They're to clean environmental surfaces. One wipe is pretty wet, and you will wipe down your table, your stretcher, your wheelchair, your iMed pump, your computer stand. As long as it's wet, you can use that wipe. One wipe, 1 minute. The contact time, wet time, is 1 minute. It has to stay wet on that surface for 1 minute to kill all the bugs on it. Okay? So that doesn't mean you wipe and you dry. You wipe and you let air dry. Okay? 1 minute before you can put anything on there, put a blanket on there and set a patient in the wheelchair. 1 minute. Okay? The other thing to remember is that these do not kill Clostridium difficile. What did I already tell you about Clostridium difficile? What do you have to clean with? Bleach. Right. Housekeeping is going to use Clorox. It's 3 minutes. In the isolation carts, there is dispatch wipes. This is bleach. Do not get it against your uniform. Do not get it any place in your eyes. You must wear gloves to clean. 5 minutes contact time. 5 minutes to kill Clostridium difficile. So when you wipe down that table, bedside stand, whatever, with bleach, it has to stay wet 5 minutes. Usually takes 2 wipes. Wipe once, let it air dry, wipe it again, because it has to stay wet for 5 minutes to kill Clostridium difficile. Okay? It's very important. All right. Cleaning of computers and Cisco phones. We ask that you clean them when you come to work, anytime during your shift if they need cleaning, and before you leave for the day. Okay? I don't know about you, but you know, a cell phone and you have it up here next to your face. There's makeup, there's, you know, you may sneeze or cough, you're talking into it. If you don't clean it and then I give it to Catherine and she uses it for 12 hours and I've got the flu the next day, she could pick it up off that phone. Or then it goes to Elizabeth for the next 12 hours, okay, and now Elizabeth has the flu. All right, so it's very important that you clean that equipment that you share, that you pass from shift to shift. All right, keyboards. Keyboards are infection control keyboards. You can wipe them down with that hydrogen peroxide wipes, okay? Clean the sensors because they'll beep at you if they're dirty, okay? So it's very important that you clean those. And that's not housekeeping's job. That's everybody in this room. Everybody who uses that equipment, it's your job to clean it, okay? Employee incident reports. Hopefully you'll never have to fill one of these out. But currently, we are on a paper process. This is an employee incident report. It is a purple paper, okay? If it happens to you, you fill out the purple paper. Purple's for our people, okay? If you get a needle stick, a contaminated needle stick, you will complete this purple paper. I need to know what happened. I also need to know on the back who you were exposed to, okay? John Doe in the ER. Now, in the ER, do not wait to report this. Same-day surgery, outpatient procedures. These patients are either going home, to heaven, or to jail, and I cannot get blood from a couple of those places, okay? So you need to take care of yourself, bleed the site, get it cleaned up, wash your hands, put a Band-Aid on it, fill out the incident report, and before that patient leaves, we need to have their blood drawn and your blood drawn. It's all free and confidential. That's a 4-letter word again, okay? It's all free and confidential. It does not show up in the patient's chart. Employee health pays for this, okay? You cannot find the results in the computer. You must contact employee health for the results, okay? Again, I need to know who you were exposed to. These purple papers come to occupational health up on the 2nd floor, okay? Do not leave them in the supervisor's desk or in an envelope somewhere. These need to be delivered to occupational health. Now, if it happens between Monday through Friday, 8 a.m. to 5 p.m., please contact occupational health directly. We can draw your blood, okay? If it doesn't happen Monday through Friday, 8 to 5, but nights, weekends, and holidays, okay, then you must contact the nursing house supervisor. We have standard protocols, we have standard orders, okay, and it'll all get done confidentially and free, okay? And you say, but I work in housekeeping. I don't work for the nursing house supervisor. No, but they are occupational health eyes and ears when we aren't here, okay? So yes, you will contact the nursing house supervisor. They are the boss when no one else, when all the other offices are closed, okay? All right, bloodborne pathogens exposures we've talked about. Injuries. If you get a cut, a bump, a sprain, a pain, a slip, a trip, a fall, you hurt yourself, okay? Again, we're going to fill out the purple paper. I need to know what happened, okay? Please, please do not go to the emergency room. You will get an emergency room bill, okay? You must contact occupational health. You may contact nights, weekends, and holidays. You can contact the nursing house supervisor again. We are real nurses. We can take care of you. We can give you we can send you home. We can get you in with another physician at another clinic a lot faster, okay, than sending you to the emergency room. If we deem it truly is an emergency, we will send you there, but we will also call and they will expect you and we will take care of the billing, okay? So please do not go to the emergency room unless you are sent to the emergency room, okay? We use an off-site clinic and they see our patients on, extended hours and on weekends, okay? Do y'all have any questions about occupational health or workers' compensation? Okay.